Okay, so because it's 12:01, so I want to start because I respect your time. So I'm gonna start with our. Okay, so you all can see my screen. Everybody's good. Okay, so I really want to welcome you all to SureSuccess Nursing Hub. It's a pleasure to have you all. It's amazing that you guys are able to make it and take the time out. I hope this session brings you the information you're looking for or help you in any way. So this is our favorite saying, like I love Napoleon Hill's this thought process. Focus on the possibilities of success, not on the potential for failure. When we start preparing for NCLEX, the first thought we have in our head is like, oh my God, am I gonna fail this exam? Am I gonna pass or am I gonna fail? It's scary. So we strongly believe that you focus on the possibilities of success and not go in the negative direction of thinking, am I gonna fail? What's the objective today? By the end of this session, you will know about NCLEX RN exam. New generation NCLEX RN is coming in 2023. April 2023 is the first time when it's going to come in. So we're going to give you like a 3 to 4 minute video review about NCLEX RN new generation. What is CAT? Computer adaptive testing. You might feel some of these terms, like of course, the word NCLEX is really familiar to you, but some of the terms might come across as like, oh, I have never heard it. But don't worry about it. We're going to go in details about it. So what is the content of NCLEX? Exam question formats, test strategies for NCLEX, critical thinking tips, and what is our purpose, plan, and how do we help you in achieving your goal of becoming an RN? So a little bit about us. We are 2 value-driven Canadian registered nurses who want to help others achieve their dream of becoming RNs in Canada, RN states, or wherever you are planning to do it. We truly do understand the value of the RN designation that follows your name and the feeling of fulfillment that comes with it. I have experienced that, and I'm pretty sure like some of you I have spoken to over the phone. I always mention that I do understand those 2 letters, the value and the importance that they have for you. That is what we are working towards. We want those 2 letters behind our name, and they're really valuable. They have immense importance, not just to you, to us as well. We do want you to achieve that. Okay. I think students are just coming in. I'm just gonna quickly like give like a little pause so that they can just all join. Alvin, how many participants do we have? Can you see? You can't see.
We have 12 here.
Okay, that's good. That's good. Okay, so we are talking about us. So the third is we are committed to ensuring your dream becomes reality with a strong desire to assist you in many ways. We will push you when it's required. We will encourage you. We will be with you. We're gonna stand with you until you reach that finish line. It's not that we're just teaching you. We're not just teaching you. We're doing a lot more than that. Emotional support, psychologically being there when you feel like you can't do it anymore, when you think that I just need that extra little push, or when something's not going right in like personal life. Things happen. It's life, right? How can we help you? We are your guide. We are your mentor. We are your teachers. We are your support system. So consider us all in one person. Okay. Your success. And we say this with a lot of, value to it, that your success is actually our responsibility. We will be responsible for your success. So anytime you study, it's 100%. 50% comes from the student, 50% comes from the teacher. That 50% that's from our side, we're not gonna be behind on that. We will do our very best effort to make sure that we are giving you that 50%. And the other 50%, we will be pulling you with us that, okay, you know what, we both have to work together. The last point, people who spoke to me, I tell them all the time, we believe that you're not only preparing for just an exam. It's not just about an exam, but for that day when one of your decisions will save someone's life. It's very, very important. NCLEX is not just an exam. RN is just not a title. It's about, it's a lot more than that. Okay. So that's about us. actually who we are. You probably are like, okay, I have heard the name a lot, SureSuccess, SureSuccess. Who are you? Like, I don't see you guys, right? So this is me. I couldn't find a better picture, trust me, but this is what we're gonna work with. So I do have 12 years of nursing experience. Alveen and I are actually classmates from nursing school. So we already know each other's strength, and that's why we have collaborated, because our goals are the same. So I have expertise in clinical and theory nursing in India and Canada. I am a professor at the University of Ottawa, and I teach with Algonquin College. I have taught RNs, RPNs, PSWs, labs, clinicals, some of the theory classes. So I've done it all. I do know how the system works here, and I can definitely provide you the best experience, like the best guidance, because I know how they are, like what is the criteria to evaluate you. Mental health is my forte. I've experience in mental health, critical care, long-term care. I worked as an infection control lead during the COVID. So tell me about it. Right now, I'm working as an inspector with Ontario Ministry of Long-Term Care. My badge is here. That's the only picture I could get. So this is it. So next, I'm going to hand over to Alveen to tell you guys about herself. So Alveen, the floor is all yours.
Hello guys, my name is Alveen, and welcome to SureSuccess Nursing Hub. I'm the second face behind SureSuccess Nursing Hub. As Saurabh have explained you previously that we both were classmates. We graduated from CMC Christian Medical College in India, and I have 12 years of nursing experience as well. I'm specialized in medical surgical nursing, critical care, emergency, and nursing management. I worked in emergency, I worked on the floor, I worked in med surg floor, I worked as a manager, I worked as a deputy care in long-term Canada, long-term care in Canada. I have passion for teaching. I love teaching. It comes to me naturally, and it comes maybe genetically because my parents are teachers. I have experience in teaching NCLEX RN and the REXPN student previously, and some of my students are here joining today because they are stepping forward for the NCLEX RN exam, and they can tell you that how passionate I am. So this is me. I'm the second phase. I will hand over the screen back to Saurabh, and thank you so much, Saurabh, for letting me introduce myself. Thank you.
Thank you, Alveen. So next is the purpose. This is a very interesting slide, not just because it says purpose. It's because it's to help the aspiring IENs to prepare for NCLEX exam in an efficient manner. When I say efficient manner, I truly mean that someone who's teaching you need to know what is the content, what are the strategies, what is NCLEX looking for. So we provide you with everything. We want to give you all the tools possible to succeed your exam in the first time. We do the career counseling and guidance, navigation of nursing career after becoming an RN. So, you know, I know like many of you go do the exam, became an RN, and now you're like, okay, what do I do next? Where do I apply? Where do I want to go? So we do, like, once you become a student with us, you are our student forever. We are lifetime kind of friends. We are your references everywhere, anywhere, because we are teachers. In Canada, as teachers, you can give the references. We're not your friends. We are your teachers. We are your mentors. So we can actually give the exactly good reference. Career counseling, where should you go? Where can you make money? What's the best option? Everything, right? So I want to show you guys a very interesting fact about CNO. And okay. So this is a nursing registration exam report from CNO. I don't know if any of you have ever gone here. Alveen, you can see the screen. Okay, perfect. So this is very, very interesting. I will explain you how. So this is from 2017 to 2021, NCLEX RN exam pass rates for international educated nurses. Okay. So you can see it consistently stayed 50 to 60%, like it hasn't reached 60% yet. So 51.1%, 53.6%, 53.3% in 2019. And this is the first attempt I'm talking about. every time the attempt goes higher, the passing rate has gone lower. So in 2021, the pass rate was only 56.2%. That's why when you see people showing their results on the screen, like other institutions, they're showing you 6 or 7 students and you're like, oh my God, I just saw them like 3 days ago. They're coming up again, because teachers are teaching probably hundreds of students, but the passing rate is only 50%. And even if they tell you, no, our passing rate is amazing, it's not true, because it doesn't demonstrate here, right? So in 2021, 1,832 people wrote the exam and only 56% people passed. And that's literally like not even 700 people, like 800 people, like 800 or some, I would say 900 people passed. Yeah, 900 people. And every time you go down, second attempt, you look at it, it's a second attempt, 666 people rewrote and 38% people passed. Every time you move down, the passing rate has dropped. Okay, very, very important. Otherwise, I want to show you Ontario Educator, right? This is from CNO's website, okay? Look at this one. These are the students that I have taught. Look at their passing rate, 81.5%. And the rights are even higher because there are 4,600 people. We are only 1,800 people. So that means like almost 3,000 students have passed the exam, right? So, so it's very, very important that you understand this point. I really wanted you to understand this. Give me a second. Okay. So I'm going to go back to our slide. So this is what our purpose is, for you to become that 56.2%. Okay. All right. So how can we help you? Like now you must be like, okay, you have already told me that only 56% people pass. What are you going to do? How can you help in achieving my dream? Because becoming an RN is a dream for me. Let's talk more about it. We will be talking a lot more about it in the coming slides. Our plan, how we are going to move about it, what kind of resources do we provide? Sorry, my throat is killing me, but okay. So first of all, let's start by what is NCLEX RN exam, right? You keep hearing the word NCLEX. What it is? NCLEX it stands for National Council Licensure Examination Registered Nurse, okay? Very, very important point. It's a minimum competency and is based on the knowledge and behaviors that are needed for the entry-level practice of nursing. The NCLEX exam has only one purpose: to determine if it is safe for you to begin practice as an entry-level nurse. Some of you who have spoken to me have always told you they're just trying to determine that you're not going to kill a patient, right? I have always said that, and I'm sure you remember that. Why must you take the NCLEX RN exam? Why? First of all, there's no way around to become an RN, right? So the second thing is the designation registered nurse or RN proves to the regulatory authorities that you can actually deliver safe and effective nursing care, okay? Another point I wanted to mention was the exam not only tests your knowledge, but your clinical judgment as well. Like how are you going to perform as in a clinical situation? And this is going to be a lot more in 2023. 2022 only have experimental questions and they keep coming, but in 2023, clinical judgment will be based on case studies, and we're gonna watch a video about in the next few slides. So I just mentioned to you that it is needed for entry-level practice of nursing, but what is entry-level practice of nursing, right? So, and how do they determine this? So the National Council conducts a job analysis study every 3 years, which is NSCBN. You all must have heard of. The state board that conducts all these, the examination is conducted by them. So what is the study? What are you talking about? So they did the last study in 2019, resulting in next generation NCLEX RN. So what do? They look at where the new RNs are going, the beginner level jobs. What are the responsibilities they are performing? So you must have seen, like it's going to be coming in one of the slides that I have. They also check what kind of care do you provide? What is the quality of care, right? Ethical, safe, competent care, that's the goal. So based on the results of this study, the content and level of difficulty is adjusted to accurately reflect that what is happening in the workplace. So this is like a bridge, NSCBN in the middle. There is workplace, new nurses. NSCBN, before you go to the workplace, they are already checking what's in the workplace. What do these people need to know? We are in the middle. We're going to make sure that it's happening. Okay. So next slide. I see people are joining. I'm very glad they're joining, and we are moving forward to just being considerate of everyone's time. This is very important. What is NCLEX RN exam not? Sometimes we have myths, right? We have confusions. The first thing, test of achievement or intelligence. Do you think NCLEX is, you might have thought about it at one point that, oh, NCLEX is just a very difficult exam. It's like, if you're very intelligent, only then you can pass it, or you have to be very smart to achieve it. No, that's not true. I know it's like a very big statement to make, but this is literally what it is. It's not a test of intelligence or achievement. Just because, again, I've said it on the phone to many of you, just because you have passed nursing from India or any other country does not mean that you're not intelligent or you can't achieve it. It's not. It's just a different system of nursing. Western nursing, Canadian nursing is very, very different than Indian nursing. We studied in a different system. And Alvin's going to talk a lot more about Bloom's taxonomy that the Canadian and the Western countries follow to in order to assess the students, right? So also, NCLEX exam is not, please keep it in your mind. It doesn't matter if you were the topper of your class or you were the 10th ranker or the backbencher. It doesn't matter. That's not what NCLEX wants to see. Okay. Somebody just texted me, wrote in the chat that she's trying to do the exam in States. So NCLEX still remains the same. NCLEX is a standard exam, which it doesn't matter where you're writing it. You can even write NCLEX in India. You're just writing it for a different country, but the exam, the format stays the same, if that makes sense, okay? Okay. So it's designed for nurses. So it is not designed for nurses who have years of experience. So it's not that, oh, I need to have 10 years of experience and only then I can write NCLEX. It's not even designed for that. We just spoke about that it's about entry-level nurses. It does not involve high-tech clinical nurses or equipment questions. It's not going to ask you something robotic question, which is like, oh my God, I don't even know what this means. I have never read it. They never taught us. We never had these equipment. So it's not going to ask you. Entry level means literally entry level, okay? It's predictive of your eventual success in the career of nursing. No, it's not. So just pass. Again, remember I just said that we will help you in your career, RN career, because NCLEX RN exam is not predictive of your eventual success in the career of nursing. If you just pass the exam, that does not mean that you're a successful RN, because to become a successful RN, you really need to know your concepts well. You need to understand the why behind everything. And that's why, that's where SureSuccess Nursing Hub comes into the picture. Our whole thought process is about the whys. Like, we want to explain you all the whys. We both have studied in the Indian system, came to Canada, become an RN, understood the Canadian system. Alvin worked in the management. I worked in the university, understood how the Canadian system works. So we exactly know what is the missing link here. We are your missing link now, okay? All the content that you were taught in the nursing school will not be tested. That's why content of NCLEX is different than what you studied in your nursing school. Just reading Saunders is not it. I know many people pass by just reading Saunders, but that's not it. We have to focus on, okay, so think of NCLEX as a beast. You need to know the beast to tackle it. If you want to defeat the beast, you need to know the qualities of the beast. What are the shortcomings? How do I attack it? You know, like that's what the goal is for NCLEX. So CAT, I know when we were in India, CAT was for MBA students, so it's a computer adaptive test, but this is CAT too. It's a computer adaptive test. What does that mean? So I will explain more. Each test is assembled interactively. Interactively means the computer is talking to you. The computer is talking to you. When you're answering a question, the computer is like, okay, you answered me this. I don't think you're right. I'm going to test you more, right? So it's interactive. We both are talking, although we are not, but it's still talking to us. It's talking to my competence. It's talking to my accuracy. Okay. Questions are adapted to your ability level. Okay. That doesn't mean, so I've mentioned this to students multiple times. Ability, someone saying, oh, my exam was really easy. So for example, for me, if I get a test which is bombarded with cardio, which is Alvin's specialty, I'm like, oh my God, it was so difficult. I might pass, but it's difficult. But if I get mental health, oh, I'm gonna nail it. There is not even a single question in mental health that I can't pass. That's the way. So it's relative. Your strength might be in one subject, other person's another subject. So you can't even ask your friend, how was your exam? Because it's an adaptive test. It's gonna adapt to you. It doesn't care what your friend wrote who was just sitting next to you 5 feet away, what you're writing. It doesn't matter. And someone telling you online, I've seen a lot, oh, we can leak the questions. Nobody can do that. Do not trust the scammers. Do not give emails. Do not give any information to anybody until unless you saw the person and talk to them. Okay. The other thing I wanted to mention, okay, so there is a third point, and there is a point that I've written on the side of me that I really wanted to mention. Each question is self-contained. Self-contained means when you see the question, don't expect, oh, they didn't give me full information. That's it. You got a question on the screen. This is it. There is no, oh, I need to speak to somebody. That question was wrong. No, it's not. It's prepared by professionals. Alvin's going to go into detail about that. There are content creators, and these questions goes through scrutinization continuously. Like they are, they go through so many cycles before they actually become an NCLEX questions. So they are smart people sitting behind those computer screens. Do not underestimate them. They know what they're talking about. There's a point that I want to mention. So the computer adaptive testing ensures that the questions you are answering, sorry, I'm admitting people as well, that the questions you are answering are not too hard or easy for your skill level. So the first question is always relatively easy, and I'm going to tell you why. Sorry, someone's mic is on. Can you please mute it? Sorry. Okay, so the next slide, I'm going to talk about it. So this is the slide. This is how CAT does. The first question is actually just at the passing grade. So it's going to be easy, trust me, because we all have studied. Passing grade question is going to be easy. You did that question right, you went up. You did another question right, you went up. You did another question right, up, up, up. Now you did it wrong, you're coming down. Okay. If you keep doing the questions wrong, you're going to come below it. And these are the questions at the bottom. So even if you do all the questions which are easy and you're just at the passing grade, you're still going to fail. Because what is the goal? The goal is to go above this line. This is pass. The line is not pass. Below the line is fail. Okay. I'm gonna another point I want to mention. So the first question is at the level of competencies, of course, the minimum level of competencies, entry practice. If you answer that question correctly, the computer selects a slightly more difficult question because the computer starts, now it's talking to you. Oh, you did it right. Let's see what you got for me. So it's asking another difficult question. Okay, you did this right. Okay, let's go forward. Let's see what more you know. The more you stay above the passing grade, the higher the chances of passing. Once you start getting very simple, easy questions, think again. That's not a good sign. We don't want easy exam. Like, don't give me the easy exam. Give me all the SATA. Give me all the select that apply. Why? Because Alvin's going to explain a lot more about it. The higher the level, SATA is the top level of Bloom's taxonomy. You get SATA, you will pass in 75 and come out, because SATA is just higher level of critical thinking. Once they assessed you, they're like, okay, good, this person's good. I'm gonna send this person the blue screen. Okay, good, let's go. We're done. Okay. Another point that I wanna mention, if you answer the first question incorrectly, the computer selects a slightly easier question. By continuing to do this, as you answer questions, the computer is able to calculate your level of competence. So the computer, I keep telling you, the computer is talking to you. So don't ever underestimate the beast you're talking to, right? I want difficult questions. I can only get them. So our goal should be sitting there. Okay, let's go. Give me the difficult question. They gave you the first question of the passing line. Okay, talk to the computer too. Okay, give me something that I don't know. You should be so prepared. That's what we're gonna do. We're gonna make you so prepared. You sit in front of the computer. You're like, okay, oh, you don't know. I am very prepared. I know what you got. You don't even, you have no idea. So that's what we want you to be like. Okay, next slide. Taking the exam, no time limit for each individual question. 72 seconds is a good time. Don't spend too much time, because that would mean you're reading into the question too much. 72 seconds is like more than a minute, but minute and a quarter kind of thing. No time limit. You can spend 10 minutes on a question, but that just doesn't reflect good on you, because the computer's like, okay, you're not doing anything. You don't know. What are you doing? Where are you, right? Maximum of 6 hours to complete the exam. Everyone answers a minimum of 75 questions to a maximum of questions. Try not to be concerned with the length of your test. This is the golden statement here. And we want all the students who join us, we want you to have it in your mind. When you're sitting in front of the computer, prepare yourself. I can have 265 questions, because I don't know if I'm writing them wrong or right, right? It's the computer's decision to stop when it has done the assessment. I cannot assess myself while writing the exam. The computer is the one who's going to assess me while writing the exam. Remember, every question counts. No warm-ups. There's no warm-up time. As soon as the computer screen comes up, the first question, go. That's it. That's like shoot. That's it. There is no, oh, I wasn't ready. I don't even know. Take your time. Take a deep breath. We will be talking about all those things too. But and we will prepare you before you actually go to the exam. Like the day before your exam, we'll be talking to you on constant basis, providing you all the guidance how you should be prepared. Concentration is also key. Give your best to each question, because you do not know which one will put you over the top. So every question matters. Okay. Next is what's gonna be in the exam. So now I have just told you what is it. What is NCLEX? 75 to 65, okay, it doesn't matter. Content. What is my syllabus? Okay, so this is your syllabus of the exam. So this is the content. Okay, so I'm gonna, I have some things that I wanna tell you. I wanna give you some examples, and I have it on my other screen. So look at these. These are going to be management of care is 20%. And what is management of care? It's safe and effective environment. The first subcategory is management of care, and it's one of the most important and big categories, followed by pharmacological and parental therapy follow it, because it has all the drugs. But look at this one, safety and infection control has gotten 12%, which is huge. Due to COVID, it might go up. So be careful with that. So the first subcategory, management, will include client rights, advanced directives, collaboration with interdisciplinary team. Second subcategory, safety and infection control. It includes accidents, injuries, home safety, use of restraints. People who are working in long-term care would know the importance of restraint, and how I work for ministry, so how restraints are a big deal. And PPE will come under infection control. Next is health promotion and maintenance, which is 9%. It includes the high-risk behavior, lifestyle choices, like the modifiable, non-modifiable factors kind of thing. Next is psychosocial integrity, and you can see that it's 9%. And abuse and neglect, coping mechanism, therapeutic communication is huge in NCLEX. Half of the exam, you can literally if you focus and pay attention, if you know therapeutic communication, there are a lot of ways you can, I used to tell my students all the time, if you know therapeutic communication, think half of the job is done. Because if you don't know how to respond to the patient, and also because we come from a different style of nursing, so communication was not really focused, but communication is huge in Canada. You can't ask the patient why question. And I know all of you know, but why can't I ask a why question is something that we will teach you. What is the reason behind it? Why are you asking me? I can't ask the patient why question. That's one. Next one is basic care and comfort. Assistive devices, nutrition, and personal hygiene is part of that. And the pharmacological we talked about, it includes the parenteral and everything. Reduction of risk is something like this 12%. It's diagnostic testing. It's very important to know the diagnostic testing, because if I am an RN and I don't know what diagnostic tests to do, I can't recommend it to the patient. My SBAR will flop. SBAR is situation background assessment recommendation. Another thing which is different here, the RNs have a lot more responsibility to tell the doctor, do this. They are always going to ask you, I don't know what capacity have you worked. I worked as an RN in the long-term care in the hospital. The physician, as soon as I call the physician with the change of situation, his question is, what do you think we should do? That does not mean that they're stupid and they don't know. It's because you have the eyes on the patient. They don't. They are trusting your judgment, your assessment. And if you don't know how to assess and judge the situation and use critical thinking skills, you're going to give the wrong information to the physician. That's why you won't be able to pass the entry-level exam. So that's what it is about. The next is physiological adaptation, includes fluid electrolyte imbalances and pathophysiology. Okay. This is my last slide before I hand it over to Alveen. Knowledge is power, we all know. But little knowledge in NCLEX is the most dangerous thing. Guessing game? No, don't do that. Be 100% sure, be thorough. There's no guessing game. If you don't know, you don't know. Work on it. Make an action plan. Work on what factors you are not able to understand. What is the concept? Why can't I understand it? The more knowledgeable you are about the NCLEX RN exam, the more effective your study will be. First of all, it just says knowledge about the NCLEX RN. I have given you an idea. Alveen's going to talk a lot more details. But it does say, if you're knowledgeable about the beast, you're going to be effective in studying, because now I know I'm not going to do A, B, and C, because that's not even part of my exam. I'm only going to focus on the content that is showing there and how much percentage. I will tell you guys a real life example. I was studying and my cousin was studying in a grade 12 exams. And I remember she focused on the content part, that how much questions are coming. And she always used to score more than me, because I am reading something which is, oh my God, this is so difficult. I really need to know this, but never thought about only 5% of the exam is coming from this. 95% is from something else, which is simple and easy. Very, very important to know what is the content. Focus on the content. How much time am I going to spend on what areas? Okay. So as you prepare for the exam, keep the content of the test in mind. Thinking like the test maker will enhance your chance of success on the exam. I have written questions too. The test makers will, we are taught to write the answers parallel. I have prepared tests for students. Write the answers parallel. There's no all of the above or none of the above options. Trust me. We have to write the answers that it should be so close, but not close. Like there's just one word which will change the answer. So thank you so much for your time. I'm going to come back to you guys after Alveen finishes her stuff. So Alveen, the floor is all yours. Thank you for your time. And I'm just going to mute myself now. Thank you.
Thank you so much, Saurabh. Thank you so much for giving us a beautiful introduction of what NCLEX RN is about and what it is not about. I'm going to screen share myself and just all right, guys, can you see my slide? All right, I will just, All right. So what happened is I will be discussing about the NCLEX strategies. What are you going, like how you are going to prepare yourself, how you are going to rock the NCLEX RN questions. We will be practicing some of the questions. I will show you the difference between the NCLEX exam versus the regular standardized exams as well, right? If you will ever talk to any the previous students who have wrote the NCLEX RN exam, they will tell you that it is totally different. This is it is a nursing exam, of course. They will teach you, they will test your nursing knowledge, but yet it is so different than nursing. Right? So what is it about? NCLEX RN exam is actually a standardized test that analyze a different set of behavior from those tested in nursing school. All right. So what does it test? So for example, the Bloom's taxonomy, I want to go over this one. In the school, you always, they tell you about how to remember and understand. So their main goal is to give you the content so that you will recall, you will remember, for example, you know what is pneumonia, what is tuberculosis, what is myocardial infarction. That is their goal, to teach you what are those, to understand the pathophysiology behind that. So the NCLEX exam, here is the NCLEX exam on the top of Bloom's taxonomy. They assume that the nursing schools have done the beautiful job. You already remember everything. You already understand. They will never ever test your knowledge. What is tuberculosis? What is pneumonia? They won't ask you questions. They assume you know that. All right. So what do they test? They will test the application, the analyzation. Do you analyze that particular disease? How do you know how to evaluate the student? Are you creative? So this is the thing they are going to teach you. And I know this is the fancy word. I will explain you and in a simple way. Let me go to the next slide. So this is the difference between the standard and NCLEX RN exam. As I've already explained you, the standard exam, what you have written before in your countries, in your respective countries, or in other exams, it is based on the knowledge and revision. The test is written by the content specialist, of course, and the content is always researched and planned. They are designed according to the test construction methodology, and all the questions are tested before the use of actual exam. NCLEX RN exam is the same, but yet it is different because it is not based on knowledge or the revision. As I told you, it will test your critical thinking level, okay? So what does this mean? Why I am telling you all this, that what is my purpose to tell you this thing? I want to tell you this because NCSPN has defined what is the minimum competency. As Sarab have explained it to you with this graph, this is the green line is the minimal competency. They have deciding factor. This is the minimal competency. They want to judge that are you in the passing above the minimum competency level or below the minimum competency level, right? She has explained it so well. So I just want to just go through, for example, if you have done right question here and then wrong and wrong, even if you have, this is a right question, but still you are below the minimal competency. So don't feel, okay, this one is a right question, so look at this graph. So she has done, this is the right answer, she did this right answer, and multiple right question, but it takes a long, like how many times she has to click on the right answers before she will put herself back on the passing grade. So each question, the first 10 questions are very important. So if you will have a really good, the first 10 questions, you're going to rock it, even if you will fail in few questions, for example, here or here, you are still going to be rock the exam. All right. So the next thing, what does this mean for you is the questions and answers are written in such a way that you cannot, at least in most of the cases, you cannot predict or recognize the correct answer. So here, the SureSuccess, I'm expertise and Sarab as well. So we will teach you that how to analyze the questions. That is why we are different. We are not going to provide you only the theory, but with some of the skills that how to analyze the questions, how to do that in a correct way. I will be teaching that one today. NCSBIN is knowledgeable about the strategies regarding length of answer, grammar, and so on. The answer choices have been extensively tested as well. This is what they actually want to conclude. So what behavior does NCLEX RN test? If it is not the test of nursing, so what does it actually test? It actually tests your nursing judgment and discretion, your critical thinking skills, your problem solving skills, your ability to make safe and competent judgment about the client care. You will be working with the LPNs, you will be working with the HCAs, you will be having management and leadership quality, right? You should know that which assignment is good for you, which assignment is good for others. It is a safe and competent judgment of you. All right, this is what they're trying to test on that. So before going into that, I just wanted to tell you that what are the type of questions you will be expecting in the NCLEX RN exam. MCQs, a lot of MCQs you are going to get that. You all, everybody must know that. Select all the answer choices that apply. They are the multiple response question. They will be giving you 5 or 6 or 7 options, and you are going to select that how many are, like it could be 3 or 4 out of 7 that will be correct. It's either you have to select the correct and the exact amount of the correct answers. If you haven't choose one, it is not partial marking. I'm sorry, and that's why they the CAT always take these questions as a difficult one. And you will love SATA questions. I will teach you the skills as well. But you will love SATA in your exam. If you will see, you should write your eyes. Oh my God, I got this SATA. Of course, yes, I'm going to pass. So this is just start loving the SATA question, please. So we will work on SATA, okay? And then the next is hotspot question that will require you to identify a hotspot or specific area on the graphic image by clicking on the correct area. For example, they might can ask you that which is the best spot to listen the like apical heart rate, right? You will you move your cursor and click on the exact spot. That is a hotspot question. Fill in the blank question that require you to calculate a number and then type it into the blank space. Drag and drop or order response question that will ask you to place the answer in a specific order. So these are example of some of the types of the NCLEX RN questions. So let's see what I was explaining to you before. This is the best example I can give you. So let's see the nursing school question. Which of the following complication that occurs during the first 24 hours after the percutaneous liver biopsy? So this is the typical easy question. So what you reword the question, that what are they asking? They are clearly asking the complication after the liver biopsy, right? So first thing, as a nursing student, you will see, okay, some of you will say, I know it's a hemorrhage. Right? Some of us will say, I can't recall, but let me see the options. Okay, the first is nausea, vomiting. Okay, constipation. I'm not sure. Hemorrhage. Oh, I know. It looks familiar, right? And then the pain at biopsy site. So it is the basic level, and everybody, believe me, I would love to have these questions, but unfortunately, let me tell you that how the NCLEX will test this exact same question. Let me explain it to you. So the same question in NCLEX exam will be presented as, which of the following symptoms observed by the nurse during the first 24 hours after percutaneous liver biopsy would indicate a complication from the procedure? Do you know it's the same question, right? So we will be happy. Okay, so we know it's the hemorrhage. Let's see what are the options. Number 1, anorexia, nausea, vomiting. Oh, what is that? Abdomen distension and discomfort. All right. Pulse is 112, blood pressure is 100/60, reps is 20. All right. And the pain at biopsy site. What is that? So this is a typical NCLEX question. So this is how they are presenting you. Okay. The same question they are asking in the application way. So in nursing school, I want to tell you, it is based, as you can see, they are based on the recall. They want you to remember that, don't forget, hemorrhage is the complication, right? And the second thing, they want the judgment that, do you know the comprehensive behind the hemorrhage? Do you know that the liver biopsy, why hemorrhage is a thing? The first liver is, there is a pool of blood, right? There's lots of arteries, there's lots of venous blood over there, right? And secondly, because it is a biopsy and liver is a huge organ, and whenever we do biopsy, we need to take some tissue off. And then of course, it is going to bleed, right? That is some of the comprehensive things you are thinking in yourself. The NCLEX is asking you the same question, the same thing, that what are you thinking of these things, right? Do you know? They assume that you already know the hemorrhage is the problem. They assume that you know the pathophysiology, that you know the blood and everything. But what are they testing? They want to test you that, do you know that what in the real world, that what is the patient is coming up with? What is the patient sign and symptom? I will teach you that how to analyze this question, and please go one by one. I will see. And some of the student, I know what you usually, if somebody have taken the NCLEX exam previously, for unsuccessful students, what is the biggest mistake is, they will read the question, they will read all the 4 options. I will discourage that one. Don't read all the 4 options all at the same time. Go one by one. Let's discuss. I will show you how to do that. Let's do, first is anorexia, nausea, vomiting. All right. So, you know, I'm looking for hemorrhage, right? Bleeding. So just think that if I'm bleeding, if I'm having hemorrhage, do I feel nausea, vomiting, and anorexia? Do you just feel free to chat, like use the chat button as well, okay? I don't feel anorexia for sure, right? Then I will go with second, abdominal distension. Why? Just ask why. Don't think that is it correct. Don't assume, oh, it doesn't sound, it doesn't look appealing. Don't go with that one. I will give you another example that you will, the actual correct answer is the most, the unexpected answers, right? I'm giving you the tricks here. Abdomen distension, how you're doing, okay, why it will distend? Oh yeah, it could be, you know, bleeding, and then the patient is bleeding, the abdomen is distended, right? That could be, probably that could be the answer. And discomfort, yeah, I can see, right? Let me read you. And then third, pulse is 112, heart rate is high, BP is low, 100/60, rest is 20. So what is that? It means shock, right? So does the shock represent bleeding? Yes, it does represent the bleeding, right? So what is the best answer? Abdominal distension is the good answer, or the shock? Of course, the shock, right? So, and the pain at biopsy site. And the first most important thing, the tip you should learn from this class is, you should know the expected outcome of anything. For example, COPD, shortness of breath is expected. If the person is presenting with shortness of breath, don't go, oh my God, shortness of breath is there. It is expected. After the biopsy, pain at biopsy site is expected. So please pay attention, right? What is expected outcome or expected sign and symptoms of the disease is, and what is not. All right, so this is the typical example. This is the same question. I explained it to you that what is it in a simple way, and how it is, same question is presented in NCLEX question. All good? Yeah, so yeah, you're right. All options may be right, Sarab, but again, the main purpose for us is that how to find out what is the best answer, right? So let's move on to the next slide. And we will practice the analysis level question as well. So how to analyze? Let's do that again. The nurse is caring for a 56-year-old man receiving haloperidol, 2 milligrams BID. The nurse assists the client to choose which of the following menus, right? That is funny, right? Then, okay, the number one is 3 ounce roast beef, baked potato, salad with dressing, dill pickle, baked apple pie, milk. Second is 3 ounce baked chicken, green beans, steamed rice, slice of bread, banana and milk. Cheeseburger on bun, French fries with ketchup, chocolate chip cookies, apple and milk. And 3 ounce baked fish, slice of bread, broccoli, ice cream, pineapple, drink 30 to 60 minutes after meal. So how you will see, most of the students will panic. Oh my God, I can't recall this. You won't recall, right? Oh my God, what is Alveen and Sarab? They are not the best teachers ever. They never gave us the list of the meals. How can I do this question, right? So this is the first reaction. And this is very normal. This is very normal, right? You will start panicking. But for us, I'm telling you that with the SureSuccess, and I think nobody can ever give you the exact list of the drugs, exact list of the menus, right? It is difficult. Nobody, don't trust anyone if they are telling you that we are giving you the questions. It's not possible. Our goal is that how to analyze the question. We will make you capable that how to deal with this question. Can you guess? Can anybody guess? All right, so yeah, we will tell you that how to analyze for sure. Let's go. How to approach these questions. So what happens is usually these analysis questions are often written so that the familiar piece of information is put in unfamiliar setting. This is a great example. You know the Haldol is familiar, right? The diet is familiar. But unfortunately, they put these two things in an unfamiliar setting and we are panicking. Can you recall the information? No. So don't assume that you haven't learned enough information. You are intelligent. This is where we come into picture to help you to develop those critical skills. I will show you how. So what type of diet do you choose for the client receiving Haldol? Okay, so first you have to think about Haldol is written. Oh my God, what type of diet? Can you recall? Some of you will say, I have absolutely no idea what is Haldol. Okay, I know this is an antipsychotic medication, but I don't remember the diet, my dear. I can think, yeah, there's something MAO inhibitor. I know the cheese, milk, something was prohibited, but I don't know, right? Why you don't know? There is actually no diet restriction for the clients taking Haldol. There is nothing, right? You must be working in this floor and you have seen there are lots of Haldol antipsychotic medication. There is nothing. Because there is no diet restriction, you must problem solve to determine what this question is really asking, right? So it is an unfamiliar. Oh my God, what is that? So let's do. Because you have given no other information, there is only one type of diet that can be considered, which is a regular balanced diet. So this question is an example of taking the familiar regular balanced diet question and putting it into a very unfamiliar, a client receiving Haldol. In this question, the critical thinking is deciding what this question is really asking. So let me get back to the question and show you. So, all right, so you know that how to analyze this question, okay? Haldol, oh, I can't recall. This is a drug. Let's go for the answer that what is the best, right? Go for the regular diet. Beef, okay, high protein. Baked potato is okay, vegetable salad with dressing, okay. Dill pickle, not bad. Apple pie and milk. It sounds good, right? Keep it in your mind. Second is baked chicken, good. Green beans, good. Steamed rice is good. 1 slice of bread, awesome. Banana and milk, it's the same. Yeah, that's good. Cheeseburger and a bun, French fries with ketchup, chocolate chip cookies, it's so fat. Do you think you should consider? I think most of us will eliminate. Okay, that's easy. This is how to eliminate the question. It is so much like the fatty, right? So 3-ounce baked fish, sliced bread, broccoli, ice cream, pineapple drink, not bad. 30 to 60 minutes after meal. So why I'm doing 30 to 60 minutes after meal? This question is telling you that the patient is having any GI infection or dumping syndrome. So why they are writing 30 to 60 minutes after the meal? Is there any reason? They didn't presented any dumping syndrome, so we should eliminate that. So now I have left with 1 and 2. So, okay, so let's see. Beef, and here is chicken, potato, and here is beans. This one is salad with dressing. Here is rice. This one is a pickle, apple and milk. I have bread, banana and milk. So only thing is, like, here is a dill pickle, which is not bad. But if I have to choose between the pickle and all of the sliced bread and banana, the pickle has a lot of sodium, right? So it's a preserved. So do you have any answers? So definitely, yes, you are correct. It's the 2. So this is how you analyze the question. And we will teach you the skills in the whole session in our course, right? So believe me, this is going to be fun. We will teach you the skills, and that's all, okay? All right, and let's, some of the critical thinking tips I want to tell you. The NCLEX RN exam is not just about recognizing the fact. So like examples I gave it to you, do you recognize the hemorrhage? No, it's just you should know those things before. So we will teach you in the content. When we will cover the content in first phase, we will help you to understand and remembering the facts, so that you will recognize. But how to apply, we will be doing this one in phase 2 and phase 3 of our course, okay? You must be able to correctly identify what the question is asking. Do not focus on the background information, like the patient having held all. That is not needed to answer the question, okay? The NCLEX RN exam focus on thinking through a problem or situation. And then critical thinking strategies. I really want to go one by one of this one. And I think if you want to make the notes as well, some of the students especially joined this session because they really need a little tips and tricks. So I think this will be, this is the phase I will be telling you that how to do the question. First of all, reword the question. So rewording the question is, you should know what they are exactly asking. For example, in the liver biopsy question, you should reword, okay, so whatever 24 hours, etc., they were actually asking the complication after the liver biopsy. You should be so concise, you should know. And then start eliminating the incorrect answers. Eliminating the answers, again, I'm telling you, go one by one. Each option, consider it as a yes. Read the option 1 and say, ask why it is linked, how it is linked, if it is correct, if it is related to the question, okay? And then eliminate the question. For example, the 4th point, if you remember, that take the liquid 30 to 60 minutes after eating, right? So like everything was good, but why? I have to ask myself, why I'm taking 30 to 60 minutes after eating, right? So that is the point. Eliminate the incorrect answer. Don't predict the answer. Especially some of the student I talk with, they will say, if they know the unfamiliar question, they will be panicking and they will consider either I know the question or I don't know. And they will just give up by reading the questions. They will predict the answer, especially their favorite is C. So don't do that. Don't predict the answers. And especially I would talk to one of the students, she was saying, okay, this option number B or C was so lengthy. So it looks, or they were assuming that it probably is the right answer. No, that's not. Okay. So recognize the expected outcomes. That is the most important tip of the day. Recognize the expected outcome. You should know that what you are expecting after the procedure, or what is the expected expected sign and symptom of that disease, right? So that is the most important you should know. Read the answer choice to obtain the clues. Sometimes the question, like sometimes the main problem is that you will read the question and you said, okay, I don't know what they are asking, right? Then you will read the question, oh, I don't have a clue. So don't read, go reread and the questions. If you don't know, just read it once or twice, that's all. If you still don't have clue that what they're asking, then go to the options, and then from the options, sometimes you come to know that, okay, so this is what they are asking. All right. And the next one is, let's practice one of the question here. A client with a history of heart failure visit the clinic. He states, I have not been feeling like my old self for about 2 weeks. It would be the most important for the nurse to ask which of the following questions. All right, so let's practice this one. The first option, the first strategy I was telling you was to reword the question. So let's read the question again. Client with history of heart failure means the heart failure is there. I have not been feeling like my old self for about 2 weeks. There is something wrong with this patient, with the heart failure patient, there is something wrong. And most important for the nurse to ask which of the following. It means that I really want to know about the complication. There is something wrong with this patient. Do you get me? That's what they're asking. This is what they're asking. Okay. So let's start analyzing the questions and answers, actually the options, sorry. Analyze the options again, one by one, right? I would like you to please type me why, right? Give me in the chat box. Do your ankles swell at end of the day? Okay, so why I will be asking this question? Don't read any of the 4 options. First, do your ankles swell at the end of the day? Why I'm asking this? The heart failure. Pedal edema, right? So I will say, okay, so this patient can have, of course, the right sided of heart failure, the whole body, actually systematically it's going to swell, right? Pedal edema will be there. So is it a complication? It is, the tip of the day. I told you expected outcome. It is expected, right, for them. And what does pedal edema, if his ankles are swell, so what does it will show? What is the emergency, or what is bad about that one? Is he dying with ankle swelling? What do you think? If any of you think that it is very, very critical thing, leave it an option, but I will cancel it, right? Okay. So where do you sleep at night? Okay, so let the student answer, and please brainstorm. I would really like to read your views that where do you sleep at night? Why we are asking this question. I will give you just a couple of minutes, like 1 minute, please. I want you to brainstorm and tell me, where do you sleep at night? Why are you asking this question? And believe me, if you will brainstorm about this one, you will have a new perspective of writing the questions, right? Because this one is not an easy question. This is not an easy question for anybody, right? So you will say, okay, if you will take your old strategies, you probably will choose any of the other options. I will tell you what, but I want you to brainstorm and please share. I'm waiting in the chat box. Sujata have told me like need to ask like on bed or sofa. Like, so yeah, so why we are, Sujata, you can unmute yourself. Can you tell me why you are asking that, why he's on sofa or bed?
Like need to ask the patient regarding, is it sleeping normally on the bed, or does it like positionally, like in a cardiac position, we need to have like in Fowler's position or semi-Fowler's position. So need to ask.
Yeah, so Fowler position, why if he has to sleep in Fowler position means he's having shortness of breath, right?
Right.
Yeah, so that is the reason. So the lungs are involved here.
Involved. Yeah.
Many of the students, they will tell, okay, sleep at night. Okay, so this is the most stupid, the thing. This is the first option they will eliminate in the first place, right? So that is what, that is very important. That there, it is the lungs, orthopnea. He's having shortness of breath. That is the reason why we are asking this question. You get me? So if you will see, do your ankles swell or sleep at night? Which weighs more? Of course, 2, right? Let's move on to the 3. How do you feel after eating dinner? Again, I'm telling you, ask why, right? How do you feel after you eat dinner? After eating dinner, he can feel bloating, right? Especially with the right-sided heart failure, the left-sided heart failure, you will feel bloating, right? So the GI system is more important, or sleeping at night, patient is having orthopnea, 2, right? So that is, yeah, so still 2 has the more way, good. And then let's see the 4th. Do you have chest pain when you inhale? Having the chest pain when you inhale, what does it mean? And why I'm asking to the heart failure question. Have you heard about having the chest pain when they inhale? Chest pain, very common thing. They might have angina or anything. When you inhale, when do you have the chest pain when you inhale? It happens when you have the pleuritic infection in your pleura. That is a sign of pleuritic infection, my dear. So that is why I want you to tell that everybody I have met, there is only, I think, 1%, they have chosen the right option for this one, but most of the 90% will option, do you have chest pain? Because chest pain looks so good, right? Heart failure and chest pain, oh my God, it works so well, it looks good. That is why how the people and most of us are approaching the question. No, it's not. Chest pain when you inhale is a sign of pleuritic infection. The patient is having heart failure. If they haven't mentioned pleuritic infection, he doesn't have the pleuritic infection. It is a distractor. Okay, that is how the NCLEX is difficult, and you have to brainstorm, and you will enjoy doing the, believe me, you will start enjoying doing the questions when you start understanding the strategies. So that is why the 4th is not the correct answer. The correct answer is, where do you sleep at night? The lungs, orthopnea. I hope you like this this question, and let's move on to the another one, just one more. The nurse is caring for a client immediately after paracentesis. Paracentesis is the procedure. It is most important for the nurse to ask which of the following questions. Okay, so what we are looking, reword the question. After a paracentesis, what is the most important? Nurse ask the following question. Means something, we are looking for the complication of the paracentesis. Is it correct? Right? So this is something I'm looking for. Let's move on to the options. Again, one by one, asking why. Do not read all the 4 options. You guys, do your clothes still feel tight? Why I'm asking? Paracentesis, his abdomen is like he's having ascites, right? His tummy is so big. Paracentesis, they have removed the liquid, right? What is the expected outcome? Again, the tip of the day, you should know, and you should know that what is the expected sign, what is the expected outcome. So what is the expected outcome after the paracentesis? He should feel bloated. He should, okay. To assess about any relief after the procedure. Okay, yeah, that's correct. But we are looking for a most important question to ask. Let's see. Yeah, do you feel this clothes are still fit tight? What we are expecting? We want their clothes to be little loose, right? We don't want his clothes to be tight. After the paracentesis, what is the expectation? That it is loose, right? Do you need to void? Why I'm asking this one, voiding? Is it important that I have to ask him? It is so much important for me to ask him to void. I think avoiding, no, the reason being because right before the paracentesis, whenever we are doing any procedure, I will have asked the staff, like I should have asked the patient to void before the procedure. And after the procedure, do you think it's very much important for him to void? Not that important. I don't know if you are wanting to keep it in a side. Are you feeling dizzy? Oh, why he's feeling dizzy? So he must be, there is a less oxygen, like, like he must be, the blood pressure is low. Why the blood pressure is low, right? It could be anything. The vital signs is changing, ding dong. It could be anything, right? It could be hemorrhage or anything, right? That is fine. Do you have any pain? Again, expected outcome. Pain he is going to have. What is the most important to ask that question? Are you feeling dizzy? Yes, that is the right answer. This is how you are going to approach the questions. So let me tell you, I just gave you a couple of examples. And now I just want to tell you that sometimes there are two types of test takers, my dear. Then if I tell you that, okay, let's imagine if you find a patient lying on the floor, right? Some of you will read the question, some of you will start imagining the patient, that you are going into the room and the patient, you can see, actually visualize the patient is on the floor, right? And you will start thinking in a real world, which is very important. This is a really good thing in the NCLEX to visualize, but sometimes it's a harmful as well, because this test does not necessarily reflect what happens in the real world, right? But it's based on the textbook nursing, unfortunately. No matter that how, like, they are doing their best to cover it up, like, so as Sarah told you, that it's a bridge between the clinical area and your minimum entries level. But unfortunately, the book is book. They are judging you on the book. What do I mean of that? It means that you have all the time and resources you need to provide to appropriate care of your time. Example, for checking the bowel sign. Imagine that in the exam, you have 5 minutes to check on him. In real world, do you have 5 minutes that you are listening and listening and listening? No, you don't have time. And don't assume, oh my God, the patient is having this one, I can't assess him, or, I can't auscultate for 5 minutes. It's not practically possible. Yes, it's not practically possible, but believe me, in NCLEX RN exam, everything is ideal. It is a paradise hospital in there. You have all the time, you have all the resources, you have all the equipment. There is no staffing issue. In real world, you don't have time. You don't have, you have 8 patients or 10 patients to look after. But imagine an NCLEX exam, you have only 1 patient and you are so much free. You can look after him. You can sit and watch the patient, how his urine is going. It is that one. That is why it is different. So there is no staffing problem. All the care given to client is by book. No shortcuts are used. Okay, so that is what is expected. So some of the unsuccessful RN exam test taker are like, what is a characteristic of them? They assume that they either know or they either don't know the answer to the question, right? They will memorize the facts to the answer question by recalling and recognition. They will try to find, okay, this is the question. Did I read it before? Did Alveen and Sarah taught me of that? If not, they will say, okay, no, I'm not going to answer. I have to choose one of the questions. Like, it's just a guess. They feel that way. They will read the question, they will read the answer, they will read the question again, and they will pick up an answer. They won't think why. They just feel, okay, which looks, remember that chest pain, that guy with the heart failure? They will pick, okay, there is a heart failure and there is a chest pain. They will do that one, right? Then they will choose the answers based on hunch or feeling instead of thinking carefully. That is the main point for, I think, everyone has done that thing. Like, instead of thinking carefully, sometimes we choose the answer based on our feeling. right? Please don't do that in NCLEX. As Sarab have told you, there is no warm-up time. Go. It's a go time. Answer questions based on personal experience rather than nursing theory. So again, as I told you, that sometimes you will see, okay, in my personal experience, the patient was having shortness of breath. I did this and that. But what do you do in the book, right? So that is most important thing. Remember that one. And the unsuccessful, sometimes these students, they will give up too soon because they are not willing to think hard about the question. They will say, okay, I think I'm gonna fail. So they will just keep on, they just want to shut off the computer. So don't give up too soon. If you are on the screen, you are still in the, you're still in the game. Don't give up at all. Don't, and many students don't stay focused on the questions. So we will be teaching you in detail. This is just the taste of the that what we are going to provide. So I will be teaching each and every strategies in details in the course section. So the students of the SureSuccess Nursing Hub will have good understanding of the nursing content. We will be providing in phase 1, have the ability to tackle each test question with a lot of confidence, because they assume that they can figure out the right answer. That is what we are providing. We will give you the tricks and tips, and we will give you the confidence that you can figure out the right answer, although this question is very unfamiliar, okay? So our student will not give up if they are unsure about the answer. Confidence or to think out of the box to figure out the correct answer. And they will possess the know-how to correctly identify the question, and they will stay focused on question, and we will give our best to achieve that results among yourself. Now that's all, and I will hand over my screen to Sarab. Can you please take over and tell them about the new generation nursing NCLEX, which is coming in April, I think, Sarab? Hello? Sarab, I think it's mute, my dear.
Oh, I'm sorry.
Yeah.
Thank you so much, Alveen. Trust me, it was amazing. I absolutely loved it. I think it's explained really well. This picture, Steve Harvey, and I know it's probably some of you must have seen it. It's so recent, like it came a couple days ago. This is how NCLEX is. Like everybody is orange, and what is the most orange? And now it's everybody is Steve Harvey. Who is most Steve Harvey? Everybody is like there's a this is how NCLEX tests you, which is like, you know, it's fun. We just wanted to kind of add this to you. The question with the chest pain, oh, I would ask all the questions, but no, that's the question with the heart failure that Alveen explained really, really well. Everything is valid. Like when you look at a question, that's why I wrote in the chat, like sometimes it feels like everything is right because everybody is Steve Harvey here, but what is actually right? So thinking, okay. So thank you so much, Alveen, for doing that. Next, it's about next generation NCLEX RN. It's about 3 to 4 minutes video, but I really want you guys to watch it because it's not just about next generation. There are some of the things the NCSPN talking about that are important to you. So let's watch together. Can you hear? Alveen, were you okay? Perfect. Thank you, guys.
Research shows 65% of nursing errors result from poor clinical decision making, and 50% of novice nurses are involved in those errors of nursing care. Are entry-level nurses making the right decisions? At NCSBN, we are dedicated to assessing and adapting to the rapidly evolving healthcare environment. We know that the next generation of nurses will need to make more complex decisions about client care. To meet today's client needs, improved measurement of the nurse's clinical judgment is critical. That's why we're developing next generation NCLEX. Clinical judgment is a combination of critical thinking and decision making. To evaluate clinical judgment, the next generation NCLEX examination questions will focus on interactions between nurse and client, the client's needs, and expected outcomes. Experts in the latest testing techniques and technology worked with expert nurses to provide cutting-edge solutions on how to best create a test around this model. The Clinical Judgment Measurement Model is a framework designed for testing. It complements the nursing process and other evidence-based nursing theories or practice. To best explain the next generation NCLEX exam, we simply have to look at examples of these new types of questions. Once you see them, it's very clear how they reflect real-world nursing care. Each uses realistic scenarios or case studies like you would see in a typical nurse-client interaction, and focuses on the types of decisions nurses will have to make in a clinical setting. Extended multiple response. Extended multiple response items allow you to select one or more answer options at a time. This item type is similar to the current NCLEX multiple response items, but with more options. Extended drag and drop. Extended drag and drop items allow you to move or place response options into answer spaces. This item type is like the current NCLEX ordered response items, but not all of the response options may be required to answer the item. In some items, there may be more response options than answer spaces. Close or drop down. In close or drop down questions, you can select one answer option from a drop-down list of words or phrases and can be found within tables or charts. Enhanced hotspot. Enhanced hotspot items allow you to select the answer by highlighting predefined words or phrases. These types of items allow an individual to read a portion of a client medical record and then select the words or phrases that answer the item. Matrix grid. Matrix grid items allow you to select one or more answer options for each row and/or column. This type of item can be useful in measuring multiple aspects of the clinical scenario with a single item. These new item types provide the nursing student with a fidelity-based exam, reflecting the complexities of clients in a variety of healthcare settings. As you can see, the next generation NCLEX is an exciting enhancement to an already rigorous exam, using the latest testing techniques to maintain the high level of reliability and accuracy of the NCLEX while meeting the changing needs of nursing regulation, public safety, and healthcare. It's all about protecting the public and achieving the best outcomes for clients, nurses, and institutions.
I hope you guys enjoyed this little video. I'll share my screen again. All right, so that was the video about like literally a quick glimpse of. We already know the exam is so complicated. It's gonna get more difficult for sure. By the sound of it, by the way they're talking about, it's getting more difficult. The more they come close to real world, it's book is easy still. The real world is gonna change things a lot. Okay. So what is our plan? Now we have told you all about that it's gonna be difficult. It's gonna be this. So SureSuccess's plan for your successes, we provide online programs with relevant core content. All the things we talked about, we will explain you all. So when we say relevant core content, it's about the pie chart that I showed you in the picture about different categories. And we will be focusing on the categories based on the percentage. It's not that we're going to teach you basic care and comfort accounting to 20%. Like basic care and comfort is going on for a long 2-3 weeks. It's based on, it's already divided on how the content is going to ask you questions in NCLEX. Engaging and interactive real life examples from our own experience. Engaging and interactive, you already saw Alveen explaining your questions. She tried to engage you and interact you, and you guys were interacting with her. It's going to be more when the groups get even smaller, because you will be able to answer us and you will be familiar with us. You will know us, so you will feel more confident to answer on the microphone. Recorded sessions to review at your convenience. We do understand that life is really difficult. So even this, the first session, the orientation, we are recording it because we do know it gets really difficult. We have kids, we have family commitments, we have jobs and things. Sometimes life happens. So recorded sessions are to review at your convenience so that you still know the information. Question taking strategies, Alvin has explained a few of the question taking strategies. We will be going in details about that. Help with developing the critical thinking and understanding the why behind every concept. Alvin has focused a lot on this today, just to kind of give you guys an idea how we are going to achieve this. So the next part is, it's just a continuation of the same thing. We bridge the gap between your knowledge, judgment, and critical thinking skills to help you better understand the nursing concept. We do understand that coming from a different country with a different mindset, where we studied at knowledge and recognition aspect, where you study at the night, you write the exam the next day and you pass, because the exam is asking you pathophysiology of, let's say, heart failure. Oh, I remembered it all and I'm just gonna go and paste it. So that's not how NCLEX is working. So you do have the knowledge. We're just gonna help you bridge that gap between how you used to think. It's just like thinking in a different way. You're just gonna reset your brain to think in a different way. Because it's focused on patient safety. And in NCSBN's website, the last point was because it's all about patients. Everything is about patients. It's patient safety. We want to be sure that we are providing the best possible care to the patient and not creating complications and making someone's life worse. Okay. We do assist with decreasing the time spent in preparation, because we will be guiding you to the right resources. We are not going to be teaching the whole Saunders book, whole Mosby, because that's a lot of time. That's time consuming. So we are providing quality material. Alvin and I have been working from the past more than 6 months on just the content. And I know sometimes I talk to the students and they tell me, oh, I have this and that. And I'm like, you name it, I know it, because I have reviewed it already. I already know which resources are not going to help the students pass the exam, which we have done so much research in the past 6 months. We have seen the market trends. We do understand. And the 56.2% in 2021 is actually a perfect examples of how what other institutions and what other people are doing is not working. Some people are definitely passing, like maybe the few of them out of, they have 150 people passed or 30 people passed. But that's not the goal. How am I going to be in that 50%? Why can't I pass? So as I have said in the previous slide, we take responsibility for you. We take you under our wing and think, oh, we're going to help the student the best way possible and we can. We help you develop the critical thinking skills, the strategies, and not just to pass the NCLEX, but to become a successful RN in future, right? What happens with the students is when they go on the floor, I've worked in different roles, and I've seen new nurses, new RNs coming on the floor, and you can just tell. You can literally tell this person is an international educated RN. She has done her RN a year ago, because there is a different style. Alvin and I will be teaching you the communication strategies. I have seen like international nurses talking to the patients in a way which would almost like, verge towards the end of being verbal abuse, because we were never told how to talk to the patients. It's just very different world, the kind of questions you can ask. So RN is not just a title which has like a lot of status. It comes with a lot of responsibility and accountability. There is a very high expectation from the RNs. When you go in the work field, you will realize people really like respect RNs, and there is a very solid reason behind that, because they do the best job possible. Their job is very hard. They're very hardworking, but their critical thinking and their analysis is actually what is saving the patients, not just the doctors writing the medications. Okay, so I do want you to realize that part. We strongly believe in thought-provoking, and we have given you an example today. With Alvin, she asked you questions. Think why. She kept asking you. I know some of you might not be like, oh, I wasn't expecting that you were going to ask me questions. I came here to just listen. But we wanted you guys to understand what it is going to be in our class. It's not going to be like a passive sitter and just sitting there. We are going to encourage you. We are not, again, we're not just helping you become an RN, passing the exam and go bye-bye. We want you to be confident. We want you to be successful on the floor. We want you to be able to have a conversation with anybody you want to on the floor and feel like, oh no, I know. I can tell you, and Alveen can second me on that too. When I go to the floor and when I teach people, they're like, oh, I did not know you were an international educated nurse. And I'm like, no, 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 I am. I'm a proud international educated nurse. I have learned my way through it. And whatever I'm teaching you now is actually my real education that I have studied in India. I just have adapted because we are adaptable. So you have to always wear this tag proudly. I am an international educated nurse. I do know my stuff, and I am a strong nurse, because we are representing our country as well. So you will, I don't know if you guys have seen on CNO's website, the new thing is 65% of the nurses in Ontario were from India. I think 56.7, sorry. 56.7% of the nurses came from India, followed by Philippines 35%, and rest of the other countries. So most of the nurses are coming from India and getting registered. But again, the passing rate, people might not pass in the first time. It's okay if you don't pass in the first time. That's not a big deal, but you have to give it your best shot and then think, oh, you know, I gave my best and I couldn't do it. That's okay. I'm just gonna go. Okay.
Can I just add one thing here?
Yeah, sure, please.
Yeah, so the thing is, I really want you to tell here that with the SureSuccess, there are many times, like in my previous experience as well, I have encountered some of the students, okay, I will pay you this thing and you have to make me pass. So this is the wrong thing. The thing is, let me tell you that this is not practical. The thing is, like how much you are giving. We are the catalyst, you know, you are the one who was writing the exam. We are the catalyst. Our main motive is to tell you, to get you familiarized with all of the material, number one, and make you capable of doing the strategies, how to read the question, how to focus in the question, how to, you know, how to do the questions. That is our main goal. We will be teaching that thing and we will improve you. We are going to make you a strong person. You have to think yourself that you are the one who are going to write the exam, because I know that everybody is going to do their best. I want and I expect you guys that the result we can provide you is only if you will receive everything, you will follow our guidance and you will do your best. Just, you know, you have to give some time. You have to, if in order to pass the NCLEX, I gave you the glimpse that how are the questions. You have to work hard. Just get ready. If you're not ready, if you don't have time, I don't suggest you that like, okay, just go and get yourself ready in next week, right? Some of the people will say, okay, I'm going to write in 15 days and make me pass the result. Like it's not possible. It is you, your brain. We are going to give you confidence and make you strategically and make you think critically, right? That is we are doing. Please don't say, I know nobody is like, everybody is different, but that is a true experience in my life. I have met not one, two, there are many people who will ask me, please teach me, and it's your responsibility. You know, like how can I've seen people that they will literally, okay, so I will teach them and they will click C. Oh, I don't know the answer. They won't read the question. They will just, you know, you remember if you have done your entrance exam, MCAT or PMT exam, you will click, okay, just C. At least out of 10, 3 or 4 will be C's. You remember that strategies? Please don't do that. NCLEX is different. Every single question will matter and we are going to prepare you for those things. All right. Yeah, that is what I just wanted to add.
Thank you, Alveen. Great tips by
Alveen. This is the both ways. We are going to give them, they have to be recipient, good recipient.
So Alvin has mentioned a great point. It's about accountability. Accountability just doesn't start when you become an RN. Accountability just has to become a second nature to you. I am accountable for my learning. I'm responsible for my learning. I am gonna give my 100%. And then if your teacher, you have to show up. I'm gonna talk about those things that just Alvin mentioned, because I am just one of those people who have, like, for me, mental health is so important because I've worked in mental health for so long. I teach mental health. So mental health is really important to me, but being mentally prepared is actually half of the battle. So Alvin has mentioned an amazing point. I'm going to go forward on our next slide. So again, we've mentioned all these points to you. I'm just going to quickly read through them. We provide you with clinical knowledge. Of course, Alvin and I have been working in the field, so we have the expertise and the clinical knowledge to help build strong foundations. So it's like real life examples, what actually really happens. So next generation is talking about real life examples, but I don't even know how real life example nurses work. I have never been an RN in Canada. So the Canadian students get an advantage because they go to clinicals in a real life setting. So we come in handy at that time because we bring our experience. We already know what you have. We bring our real life experience, and we are going to bridge you before NCSB and try to bridge you to the NCLEX and bring you to the field. So we are there for you. You can rely on us. You can ask us questions. I don't know, some of you may know, sometimes I approach students and I write, please talk to me, because I feel like they're getting distracted, and sometimes people post, oh, free resources, email us, do this, that. And I literally pick students. Some of you were picked by me from the comment section and said, hey, talk to me, it's free, please talk to me, because I don't want you guys to suffer and delay the process, because people will misguide you. There are scammers out there, and I think the worst feeling in the world is being scammed, right? It's not even about it's not just because scamming doesn't take away your money, your emotions are involved with it. Being scammed affects your self-esteem. So that's what all I'm about. Whichever resources you put, I know some of you are already our students, whichever institute, whichever group you pick, like, we wish you very best of luck. If you still need any guidance, you can contact us. The only thing is that we do want to give you the best of the best. And Alvin and I are all about perfection. Like, we spent so much time in preparing our content that we want to perfect it for you, so that I tell Alvin all the time, and she stops me from saying this. And I'm like, I want to tell the students this, like, I don't want to hear that the question came out of syllabus. And she's like, no, sir, we just give the tools. And I'm like, I know, but I want to prepare you guys to an extent that you come back to me after, or Alvin after, and say, oh my God, you guys taught us everything for NCLEX. Like, it wasn't out of syllabus kind of thing. So that's our ideology. And I believe, like, whatever Alvin said is perfectly right, and she has the right thought process. It's just that I want you guys to be like, oh, nothing came out of syllabus. Okay, I'm just gonna move forward. I know it's not the syllabus, but okay. So SureSuccess primarily focus on you. Again, I've just mentioned all these points. Each student is our priority. Like, it's not that we have hundreds of students and we can't focus on you. But you are our priority. We will be reviewing with the student every month. So the first whole month, for the first batch, we are doing 2 months just to teach you the core content. And because we want our first batch to be 100%, I want to see each one of my students to come back and say, I passed my NCLEX, because that's what I promised you. That's what is my responsibility, to teach you perfectly in that manner. You did your best, I did my best, we will succeed. There is no way around that you can't succeed when you are with us, because we already got all the resources, all the information that you need to know for entry-level practice nursing. We have the information. You don't have to buy any resources when you are with us. Your choice, you have the freedom, because many people have the resources, right? There are tons and tons of information. It is so overwhelming. The one question I get from students all the time is resources. And believe me, each one of you too here, like, we have 16 people here, like 14 students here. Each one of you have tons of resources. If you Google them, free NCLEX resources, there's a bunch. But are they credible? Are they peer reviewed? Who wrote those resources? Where is this information coming from? When I studied, I was studying 2 resources and both the resources were telling me a different thing. I was so confused. I contacted one of my resource. They couldn't answer me. And I'm like, why would you write that if you can't answer me? So that's what we want. We want you to question us too. Where did you get this information from? We want to know. And we will provide you all the references for that. So the next is strategies. Alvin has mentioned this. This is done. Strategies to navigate the question and how to answer them. Help you understand the why. We've been talking about it a lot. Common mistakes. Option C is a common mistake. Will support you in your journey and will ensure that you reach the finish line. That is our goal. We want you to be successful. How can you succeed? So this is like kind of my mental health thing where it comes. This is my favorite quote from Seneca. You must have seen it on internet a lot. Like Seneca is one of the Stoics. I don't know if you guys know, I am all about mental health and stoicism and stuff. So Seneca is one of the old Stoics. So what he writes, luck is what happens when preparation meets opportunity. We will help, we will prepare you. Your opportunity, you show up, we show up, and that's when we become successful, right? So these are just the tips, just in general in life. These are not pertaining just to NCLEX. Anything you do, delay gratification. Sometimes the instant pleasure of something will distract you from your long-term goals. Our long-term goal is to become a successful RN. Instant pleasure is, I do want to go to the party, I do want to have fun, I do want to enjoy myself. I'm not saying don't do that. I'm just saying learn how to delay gratification, because that helps you build a resilience that makes you strong mentally. No, I'm going to focus. I'm going to spend 2 hours a day on my studies. This is my goal. Because think about how successful and how confident you are going to feel and proud you're going to feel the day you tell your parents, I have gotten my RN license. I know all of you want to pick up the phone and call your parents and be like, I have passed, right? It's a great feeling. So think about that. Show up on your toughest days you feel like, oh, you know, this is the weekend, I'm not going to study, I don't have to study, it's okay, it's okay. No, you do. When you show up on your toughest days that I'm going to study, you have respect, you earn respect in your own own eyes, that, you know, when you respect yourself, you are more confident. If you made a promise with yourself that, okay, you know, I'm going to wake up at 5 a.m. this morning and I'm going to study till 7, and you fulfill that promise, you're going to feel amazing. But if you just hit the snooze and slept until 7 and woke up at 8, you're going to feel like, oh my God, I planned to study and I didn't. So show up on the toughest days. Positive self-talk, mindset matters a lot. Your positive mindset will matter. Again, my very first slide was about possibilities and not focusing on the failure. Don't consider yourself a failure before you even started. You haven't even started. You're not a failure. You're going to do your best. And people who do their best are not failures. Failure is just like a building block. It's a stepping stone. Anybody who tells you I have never failed have never tried anything in their life. I have failed multiple times in multiple things. And I am not unhappy about it. I'm proud of myself that, okay, I failed because those failures made me what I am today. Okay, so it's important. Don't dwell on things. Don't keep thinking about negative stuff. Just keep your mind clear. Practice empathy towards yourself. Be kind to yourself. Please don't be harsh on yourself. Oh, I'm a failure, I can never do anything. Don't talk like that. Practice empathy. Everyone's perspective is different. This is my perspective, Alvin's perspective, we shared with you. Your perspective, we 100% respect that. Things don't work out, we respect that. That is all life is about. It's not about being the best. It's about building something better together. And I think when Alvin and I started, we talked about, we wanted to build a community which is so strong and people feel so proud of international educated nurses. I know sometimes, like, there's going to be a time when we're going to have Canadian nurses to study from us because I have so many students. But my goal was to make the international educated nurses so strong that people feel so proud of us. So yes, enroll with us if you're interested. I know some of you have already enrolled. I'm not talking about those ones, but we will help you set a goal, make a plan, and let's get to work, stick to it, and we will reach our goal. This is mine and Alvin's card for SureSuccess Nursing Hub. You already have our numbers and everything. Our website is like almost done. We are working really hard on it, but because of some technical glitches, I live in Ottawa. I don't know if you guys have heard, we had a huge storm and everything was closed off. We had no power for a few days. So the website's coming up real soon. And now it's the time for questions. Please ask questions if you have any. Do not hesitate. Questions, comments, anything, you can write it in the chat box if you don't feel comfortable. I understand it can be very daunting. And that's what we're going to teach you. We're going to make you so confident that you come on the screen and you're like, I can rock this. Okay, let's give a couple of minutes. Sujata, you have any questions or comments? I thought I could ask you.
So we have a question here, Harvaneet. What will be the schedule of the classes? Harvaneet, the schedule will be, we will be starting in the middle of June, probably the 15th. So it is Saturday, Sunday for sure, as I'm working full time. So there will be 2 weekdays and 2 weekends. So we will be teaching 4 days, like 4 to 6 hours minimum. So that is what Sarab and I was focusing, that we will cover everything. We will cover all the material, and we will practice the questions as well. And rest of the 3 days will be our questions days. We will give you the homework for that one. And each class will be recorded. Don't worry if you can't take the 6-hour class. You can join us anytime, because some of our students are from BC, Ottawa, like BC, Ontario, and Alberta. There is a time difference. We understand that. So that is the schedule of the classes. That will be the 4 weeks class, and then 3 days you will be given homework to practice the questions. And after finishing up the theories, then we will, as I have explained, just a little glimpse. So we will go into depth about the strategies and everything. And then we are going to spend a lot of time on the questions. That is the most important thing. So the length for the whole course will be around 3 months for sure, right, Sarah?
Sorry, Alvin, go ahead. Sorry, I'm sorry.
I was thinking, so the hour will be three and like 12 weeks. I will go with the weeks, 12 weeks or more. It depends on, we have lots of resources. As I tell you, you will name it, we have that, right? Until you feel that, no, I'm ready, we will keep on giving you the questions. We will practice. Don't worry about the time. We have 12 weeks period, and you can take it after any time, you know.
I want to mention here, you studied with us the way you studied until you pass the exam. You are with us. You don't have to worry about that part. Oh my God, I didn't pass. Are they going to charge me? Are they going to do this or that? Our goal is your success, and we take the responsibility. But that doesn't mean that you have done 4 classes and now you're writing the exam and you're like, oh my God, I failed. No, that's like, let's go fair, like be very fair. I'm like, okay, I studied with you. I did everything. These are the 2-3 points I missed. Can you teach me again? Yes, for sure. You can rejoin the classes. Those particular topics will be retaught. We have a plan in place, what we are teaching first. And we are also, because Alvin is teaching a different topic and I'm teaching a different topic. The reason being, we are taking the topics where we specialize. If I specialize in maternity, I am taking maternity. If Alvin specializes in cardio, she's taking that, because we all have our strengths. So we are playing to our strengths to make it more effective, and also related to our experience. When it comes to which field does anyone have experience, because we are promising you real life examples. If I have not worked in the field, how can I give you a real life example? So we are playing to our strengths as well. It's very, very important for us that we make sure that the content, and as Alvin has mentioned, content, questions, equally important. There's no, it's not that I have read the Saunders and now I'm going to go and pass. It's not, you can pass. I'm sorry, I'm just like defaming Saunders so much. They're probably going to kill me, but it's not about that. But Saunders is, Alvin and I have like researched so much. Saunders never came on our radar. Trust me. I know it's surprising to hear because so many institutions follow Saunders. Saunders is something that came from India and just going on because they have written the notes. That's why people follow Saunders. That's
The reason, Sarab, the thing is, I will give you a funny example here for especially for the Saunders. Maybe Sarab, I never told you that thing. So I was teaching the students, I have all the resources. So one question, let me tell you the Saunders question. I can never forget that. There was a question that there was a psychiatric patient, mental health, something, right? The patient needed the restraint, right? And then what happened is the family came in and they said, okay, can you please remove the restraint? And what they have several options. And one of the option was the nurse said, okay, I'm going to remove the restraint, but you have to look after the patient. Like the family said that we will look after the patient and sit with them. And then there are other options. And Saunders corrected that person, like, let the family sit with them and look after the patient. And that is if I think it is still there. If you will read the Saunders, if somebody has gone through the Saunders, if you can please check that question there, it is still there. It is not true.
so many options are wrong. Trust me.
You cannot delegate the family. You cannot delegate the family. Okay, you go and sit and look after the patient. No. So that's why, like, I was little susceptible with Saunders. Again, it is like everybody is different. It's not the system works the same way, my dear. Cardio, respiratory, wherever. If you are a second time retaker, like I'm not saying that we are teaching you a different thing. Everybody, like cardio works the same, mental health works the same, respiratory works the same. It is how you do the questions, how you analyze the questions, right? And then again, like that, Saunders has a couple of other mistakes in them. So that is why I don't rely on Saunders. But again, we have the resources from everywhere. The best of Saunders, we took it from there. The best of Lippincott, we took it. You must have heard about a registered nurse, RN. She's the beautiful and she's so good in explanation. We have taken her resources. We have taken Mark Linex. We have taken UHERS. We have taken you name it. You in our platform with SureSuccess, you are having everywhere's the best material of everywhere's, like, all of the platforms, we are providing it to you. We have done a lot of homework for those ones. And do you guys have the assessment test like NCLEX in your course? Yes, we do. We have those one, and our website, it's just like UWorld, it is in making. So Sujata, the thing is, it is actually, that is where we are different. We are giving this platform so professionally. It is not like we are teaching it from home or so. So we will be giving you the app, right? So not app yet, but from the computer, there is our, sorry, help me finding the word, sorry. Our website is coming. You can, just like a UWorld, you can have to select the answers, questions and everything. The most important, students, the good part is here, we are going to buy a UWorld for you. As I told you, UWorld will be covering you. Everything is covering. The best is NCSBN. The last week, NCSBN, the question, if you have heard about those ones, we will buy it and then we will practice it. There are like, you will get 10 to 15 questions minimum from those paper, right? So I told Sarah many times that, like, okay, so whenever you will book the exam date, 10 days, come to us. Those 10 days, we will practice all the question of NCSBN. You will get 10 to 15 questions from that one. That is the brownie point. We will be giving it to you with the answers. It is not on you that you will buy it and Google it. No, we will explain every question so that you're good to go with that.
Okay, perfect. So the last thing is that I know we did mention about NNA, sorry, I have a question. So it will be individually. So for the when we like plan exam, so the plan of the exam, Shreya has just asked a question. The plan of the exam, we strongly recommend you to have a discussion with us before booking the exam. As I have said, we will be reviewing each student like every 2 to 3 weeks, talking to you individually, booking a meeting with you like this, and talking. Alveen, I, and you will be the only 3 people in that meeting. We will be talking about, okay, how are you feeling? Where are you feeling you're stuck? What you did not understand? How can we make it better for you? How can we work together? So because we are taking responsibility and you're taking responsibility, then we'll plan, okay, how ready do you feel? Okay, you feel ready. Okay, we can go for it. Let's book the exam now. Even if you have booked the exam, that's not a big deal, because our goal is to achieve that. Sometimes students feel prepared, just like they have done the content with us, they feel so confident, they have done the questions for 2-3 weeks, and now they're like, oh my god, Alveen or Sarab, I feel so confident, I want to go for it. We will be like, okay, there's a green light, let's go for it, let's see how you do. Because also another thing, NCLEX has unlimited opportunities. Given that, I'm not saying that you should take them, I'm just saying my goal, Alveen, and my goal is for you to pass it in the first time, nail it. Because who has the time to go through that emotional torture of 45 days again and feel like, oh my god, I have to write again, you know? Because again, I mentioned in the past, like in the last slides, that every failure kind of takes a tax on you. It's taxing on emotional health, because you're like, I don't want to tell anybody that I passed, or if I pass, I will share it with everybody. But if I fail, what's going to happen? I don't want to tell anyone that I'm preparing or anything. That's okay. Again, another important thing with us, your information is confidential. We do not share your information without your permission, without your consent with anybody. You will never see us posting your pictures without your permission on a social media website until and unless you come and say, Sarab, Alveen, if you guys need my review or you want to post my picture, you are okay to go ahead with it, because confidentiality is very important. And as a nurse, we are learning all these things: communication, professionalism, confidentiality, standards. BSN nursing in Canada is about 5 principles. It's evolving evolving professional, critical thinker, communication, professionalism, and then there's accountability and responsibility part. So when I do the evaluation for my students, I cover 5 components. So if they have met all those 5, even if they fail in one component, which is accountability and professionalism, they fail the whole course. You have to pass in all those 5 components to go forward. So we will be teaching you all these strategies. I am pretty sure you're going to feel way more confident after studying with us, after learning with us. We do encourage you to enroll with us. And because for the first month, we are charging the least amount of fees. Alveen and I have done the calculation, and literally we charge, like we teach, as Alveen was mentioning, we teach you for 24 hours in 1 week. And there are 4 weeks. If you're good at math, I'm probably okay. 24 times 4 is 96. And then the time for preparation and everything, we are spending more than 100 hours in a week just to get you the material you need. All these presentations are time consuming. They look really nice and fancy, but they take a lot of time and a lot of effort, because you have to be prepared. I never want to sell something I don't believe in. I strongly believe in SureSuccess Nursing. Students who know me from nursing school do know me really well. I am a book nerd. I've been a book nerd. I've been very studious student, and I want to be thorough. So I will do my best to bring the best. We will do our best to bring the best product out for you. So please join us. Thank you. Anyone has any other questions for us? No? Okay. Another thing I wanted to mention, please write feedback, like write me feedback. How can we improve? What could we have done better? What did you find was not helpful to you, and what was helpful to you? Because it will help us improve. We want to improve. We do need your feedback. No matter feedback is positive or negative, it doesn't matter to me. I just care about the feedback. I do encourage you, please give us feedback so that we can improve and help others. Okay, thank you. Anything else? I think we are right. It's 1:59 and we are right on time. We plan to finish at 2, so we're good. Thank you so much, guys. I look forward to talking to you. I look forward for your calls or your emails. Thank you.
Sarab, if you can just let them know our numbers again, the slides, so that.
Oh, sorry, guys. I'm so sorry.
Yeah, so that they can write down our numbers.
Yes, please do.
Have even like if you are preparing for the exam right away.
Yeah, like another thing too, Alveen, I want to call
us anytime.
Yeah, We don't charge for guidance. We don't, like, I've guided, like, I know Alvin knows me. I've spent so many hours over the phone with some of you. You must know that I've spent so much time. We don't want to charge you for guidance. Guidance is free. All this information is free on the website. We're just deciphering it for you. We're just breaking it down for you. But there comes a time, because guidance does take like time away from our actual, once SureSuccess starts running, we might not have the time to provide you guidance, but we are still available. You have questions, please reach out.
We can create a WhatsApp group so you can have
Yeah, we can, but it's like
the questions anytime. You can call us
you can text us.
I will say, I will prefer the WhatsApp. We can create a business account on that one, and you can actually join that group and you can text us any question, right? So even if you're studying and studying somewhere else, I am sure everybody is providing a really good education, and you go ahead, and if something better you can understand from us, we are more than happy, right? I'm good in pharmacology, I will tell you. So maybe pharmacology, some of the students, some from the other, you know, like they are enrolled in another institute or something. Some people come to me for pharmacology, like I just teach them free, it's okay. Right, so so feel free. You don't have to worry that you have. You know,
we don't charge you for like one question or 5 questions or 10 questions. We want you to be successful. That's our goal. We are building this community together. We encourage you to join us because we think that we have something to offer you, which is going to be very helpful in your success in your nursing career, like guiding you through what courses you should take in the future, which field you should go. Where can you have a work-life balance? Should you go to direct nursing or indirect nursing? There's so many different criteria.
Yeah, so I think this is a good point for both of us, me and Sarah, because if you want to go on floor, that's your choice. And we have experience. Sarah has a really good experience. She's a inspector in the ministry, right? I have a management experience. So even in the future, if you want to you know, grow yourself, I think you can ask us anytime.
Thank you so much for kind messages that I'm getting in the chat. It's really, really sweet of you guys to take the time to write it. And we appreciate your time. Thank you guys. Please reach out. These are our numbers. Please call us, text us, whatever you feel comfortable. We will continue. Please share us on social media, because social media does help a lot with us to reach different group of people. When you share our post, it helps someone. Sometimes people are like, oh, you know, one of my friends shared your post, that's why I'm calling you. Many people contact us through that, and I know there are so many groups, and I have recently joined all those groups, so I go in there in the comments and I'm like, oh, contact us please, we can really help you. So, you know, any questions, please do not hesitate. We are so lucky and so grateful for all of you to be here and take the 2 hours from your day to spend with us and learn. I really hope that you were able to gain something from us today. And yeah, like we both look forward to working with you. It's gonna be fun experience. I'm very funny, I think. I know. Alvin is too.
Yeah, I think Sarab, I think we should let them go. And
yeah, it's 2:03 and let's wrap it up.
Thank you so much.
Perfect.
All right, guys. Thank you so
much.
much.
Bye, guys. Thank you.
Bye, everyone. Bye.